The most important thing for me is to get the information out there to women who are older and who think that they will never have cancer attack them in their older age. They told me until you're 99 or dead, you need a mammogram.
Some things I like to talk to my patients about are different signs and symptoms they may not be familiar with that could actually be early signs of breast cancer, as well as the importance of doing their self-breast exams. We encourage that patients do their self-breast exams monthly. Some statistics say that up to 1 in 8 cases of breast cancer are actually not found on mammogram. So that's why doing self-breast exams are so important. Some symptoms that patients often don't know about that could be signs of early breast cancer include thickened areas of the skin of the breasts, inverted nipples, dimpling of the skin, changes in shape and size of the breasts as well. The nipples can have scabs or crusting. Of course, some of these can be seen with normal pathologic symptoms for other conditions that are not breast cancer, but they should be brought up to your provider and you guys make that decision together. A few other ones, obviously everyone knows any hard lumps or bumps should always be examined. Red, hot, or swollen breasts, of course, that can occur with, pregnancy or around the time of menstruation, but also can be early signs that you have breast cancer if the symptoms aren't improving. Enlarged veins, especially in the presence of red, hot, and swollen breasts, if they do not resolve, should be evaluated by your provider. Nipple discharge is not, there are some medicines, of course, breastfeeding, developing breasts can all cause nipple discharge, but often that is an early sign of breast cancer. Itching to a specific area of the breast is actually at times a sign of breast cancer, and if unresolved, should absolutely be brought up to your provider. Inflammatory breast cancer often presents as rash or sores to the breast. It can be redness, like a patch of dry skin that just doesn't resolve. Although it's a rare type of breast cancer, it is something that should absolutely be evaluated by your provider. It is very important to get your mammograms every 1 to 2 years, depending on the recommendations by your provider. So when a patient comes to me and states that they no longer need screenings because they're over the age of 74, we dive into that deeper and have a discussion about some of the factors that we look at when deciding if it's time to stop screenings or continued annual or biannual screenings. Of course, it's their risk factors, but also we take into consideration, does the patient have a good overall life and health expectancy for the next 10 years? I discuss this with the patient, and I don't make that decision by myself just based on the guidelines. So another thing I like to discuss with my patients is whether the benefits of a mammogram at this stage outweigh the risks of further diagnostic testing and imaging that may be required if an abnormality is found. What would the patient do if they were diagnosed with breast cancer? So we have a discussion, and basically I say, if you tell me right now that if you had a lump, which required a simple lumpectomy, or you had breast cancer in which you had to have a double mastectomy, if you feel like you would move forward with the treatment and the procedure, then we continue to screen. It does not mean after the age of 74 that you are no longer at risk of having breast cancer. And each person in these situations really does have to be looked at as an individual. I have a lot of very, very healthy women in the rural community that we live in that could absolutely withstand treatment, and their life expectancy and health condition is definitely over that 10-year mark.
I was one of the ladies who looked at signs. I read everything that's printed, and I had noticed at several spots where health concerns were posted that said, women over the age of 74 needn't be that concerned about mammograms, so I didn't do it. And then the wellness exams came up for this area, and I came into hometown to do the wellness. And Ashley, she's the primary person here, said, you really should go get a mammogram. Well, I thought, I don't want to do it, but I will. So I went and had a mammogram, and about 4 or 5 days later, I was notified that I had shadows and that I needed to go to Rapid City for a more in-depth procedure. Well, what they found was a tumor, which was in an inaccessible area. It could not be felt with a breast exam, and I had just had one, a manual breast exam by a physician. He hadn't felt it. So I was slated for surgery. Well, before my surgery, I fell on ice and broke my ankle in 2 places. So we had to put the surgery off for about 6 weeks. And then I went in, had my surgery 2 days before Christmas last year. And they found that the tumor was a little over 2. So I was very, very lucky. And then I had 25 days of radiation, and then I was turned loose to come back home. I was very fortunate in that in this small town, I had caregivers like Ashley and her people, and also was able to receive the therapy after surgery, which is extremely important, and I could receive that right here, right next door to the hometown clinic, in the same building. Very handy. I got to give a shout out to my cancer team, which you're given your friends, your family. I have a friend in particular here. Her name is April Ellsworth. She went in, took care of my animals, stayed at the house, took care of everything for me. She's one of my very important cancer care team. They help you do everything. They're wonderful. And people shouldn't be afraid to go have this done if they feel they don't have the funds. There is help. The most important thing for me is to get the information out there to women who are older and who think that they will never have cancer attack them in their older age. I was blown away. My surgeon told me you can have a mammogram and it can be clear. Within 6 months, the cancer can form and it will show at your next mammogram. I was appalled. I'd never heard that. They told me until you're 99 or dead, you need a mammogram. I garden. I drive, which I drive a truck, so it shows that my arm is useful. I do my own cooking. I live alone. I'm out in the country. So I would say don't be afraid of your surgery. Go have it done. Don't put it off, because you'll get through it. Cowboy up. Oh my God, I think it's so important that women don't wait. And I thank Ashley for pushing me.